The muscles of the face are embedded in the superficial fascia, and most arise from the bones of the skull and insert to the skin. The orifices of the face, namely the orbit, nose, and mouth, are guarded by the eyelids, nostrils, and lips respectively. It is the function of the facial muscles to serve as sphincters or dilators of these structures. A secondary function of the facial muscles is to modify the expression of the face. All the muscles of the face are supplied by the facial nerve. The occipitofrontalis is a broad muscle which covers the skull from the occipital bone to the eyebrows. It consists of two parts, the occipitalis and the frontalis, connected by a wide tendon or aponeurosis called the galea aponeurotica. The occipitalis arises by tendinous fibers from the lateral two-thirds of the superior nuchal line of the occipital bone. Then it inserts to the posterior end of the galea aponeurotica. The frontalis has no bony attachments. It arises from the anterior end of the galea aponeurotica and continues with the muscular fibers of the muscles of facial expression, such as procerus, corrugator superciliary, and orbicularis oculi. The galea aponeurotica, or epicranial aponeurosis, is a wide tendon between the bases of the occipitofrontalis that cover the upper part of the cranium. On the either side, it is continued over the temporal fascia to the zygomatic arch as a layer of laminated areolar tissue. When occipitofrontalis contracts, the first three layers of the scalp move forward or backward because of the loose areolar tissue of the fourth layer of the scalp, which allows the aponeurosis to move freely on the pericranium. The frontal bases of the occipitofrontalis can raise their eyebrows in expression of surprise or horror. The frontalis is supplied by the temporal branches of the facial nerve, and the occipitalis by the posterior auricular branch of the same nerve. The function of the eyelids is to protect the eyeballs from injury and excessive light. The eyelids also keep the cornea moist by spreading the tears. The orbicularis oculi closes the eyelids and wrinkles the forehead vertically. It consists of three parts: palpebral part, lacrimal part, and orbital part. Palpebral part, arising from the medial palpebral ligament and mostly located within the eyelids, gently closes the eyelids, as in blinking or sleep, to keep the cornea from drying. Lacrimal part, passing posterior to the lacrimal sac, draws the eyelids medially, aiding drainage of tears. Orbital part, overlying the orbital rim and attached to the frontal bone and maxilla medially, tightly closes the eyelids to protect the eyeballs against the glare and dust. Then all three parts of the orbicularis oculi contract, the eyes are firmly closed. The levator palpebrae superioris with the superior tarsal muscle do not belong to the muscles of facial expression, but they serve as dilator muscles of eyelids. One more muscle related to the forehead is the corrugator supercilii. It arises from the superciliary arch and inserts to the skin above the eyebrows. This muscle is responsible for the vertical wrinkles of the forehead, as in frowning. The shape of the mouth and lips is controlled by a complex three-dimensional group of muscular slits, which include the following: the orbicularis oris, the sphincter around the mouth, the buccinator in the cheek, elevators, retractors, and avatars of the upper lip, and depressors, retractors, and avatars of the lower lip. The orbicularis oris is the first of the series of sphincters associated with the alimentary system. It encircles the mouth within the lips, controlling entry and exit through the oral fissure, the opening between the lips. The orbicularis oris is important during articulation, speech. The buccinator is a thin, flat, rectangular muscle that attaches laterally to the alveolar processes of the maxilla and mandible, opposite to the molar teeth. The buccinator occupies a deeper, more medially placed plane than the other muscles of facial expression, passing deep to the mandible so that it is more closely related to the buccal mucosa than to the skin of the face. This muscle is active in smiling, also keeps the cheek taut, preventing it from folding and being injured during chewing. Additionally, the buccinator and orbicularis oris work with the tongue to keep food between the occlusal surfaces of the teeth during mastication, preventing food from accumulation in the oral vestibule. At rest, the lips are in gentle contact and the teeth are close together. The shape of lips changes during the speaking, singing, smiling due to contraction of the dilator muscles of the lips. These radiate out from the lips, rising from the bones and fascia around the oral aperture, and converge to be inserted into the substance of the lips. Traced from the side of the nose to the angle of the mouth and then below the oral aperture, these muscles are levator labii superioris alla nasi, levator labii superioris, zygomaticus minor, zygomaticus major, levator anguli oris, risorius, depressor anguli oris, depressor labii inferioris, and finally mentalis. The superficial muscle of the neck, platysma, also belongs to the muscles of facial expression. It arises from the subcutaneous tissue of infraclavicular and supraclavicular regions, and inserts to the base of mandible, skin of cheek and lower lip. The platysma can participate in the depression of the mandible and tense skin of inferior face and neck. The muscles of the nose may provide evidence of breathing behaviors. Although these muscles are functionally important in certain mammals, they are relatively unimportant in humans, except in terms of facial expression and in the specialized fields of aesthetic plastic surgery. The sphincter muscle of the nose is the compressor nasi, and the dilator muscle is the dilator nares. One more muscle related to the nose is the procerus, located between the nasal bones and the skin over the glabella. This muscle wrinkles the nose. The muscles of the ears, as well as the muscles of nose, are important in animals and are capable of directing the ears toward the sources of sound, but they are less critical in humans. However, the rudimental muscular fibers may be found around the ears. We call them anterior, superior, and posterior auricular muscles. All muscles of facial expression are innervated by the terminal branches of the facial nerve: temporal, zygomatic, buccal, marginal mandibular, and cervical. Damage to the facial nerve can take place in the internal acoustic meatus, for example by tumor, or in the middle ear by infection, or, for example, during operation, in the facial nerve canal, or even inside of the parotid gland, and it will cause the drooping of the lower eyelid, and the angle of the mouth will sag on the affected side. This condition is called the Bell's palsy.